Depression. It's not just something to push to the side or just something that people can get over in a day's amount of time. Depression is real and shouldn't be looked down on. According to the American Psychiatric Association, depression is a common and serious medical illness that negatively affects how you feel, the way you think, and the way you act. Depression is more than just being sad. It's having these large amounts of doubt that stay with a person and tend to never leave their train of thought. Depression breaks down into two major mood disorders. The first mood disorder, which is also the most common, is the unipolar disorder, or also known as major depression. The second mood disorder is bipolar disorder, or again known as manic depression. Lewis Walport, who wrote Malignant Sadness in the year 2000, said close to 20% of Americans are likely to suffer from the major depression at some point in their life, and women tend to get this disorder more than men. Major depression also can be called clinical depression. It is always constant. Clinical depression sometimes can affect a person once in their life, but in other situations it can occur multiple times in one's life. Having major depression disorder, some of the symptoms may be lack of enjoyment, always tired, difficulty eating, sleeping, doing work, and so many other symptoms. According to the National Institute of Mental Health, major depression affects about 6.7% of the U.S. population over the age of 18. Depression in children and teenagers is uncommon, but it does happen. No matter what age it affects a person at, it is still a very serious situation that should never be taken lightly. Manic depression, or bipolar disorder, is rare and is said to only affect about 1% of the U.S. population. Both men and women are able to develop manic depression. WebMD says manic depression is a complex disorder that most likely stems from a combination of genetic and non-genetic factors. The way a person feels while having manic depression is similar to major depression, but it is not a constant feeling. Mood changes occur very frequently with having bipolar disorder. 1 minute a person can be feeling joyful and full of life, but the next minute they are sad and don't want to do anything. When episodes of mood changes happen 4 or more times in 1 year, it is called rapid cycling. This disorder tends to interrupt the lives of people between the ages of 15 and 24 and stays with them for the rest of their lives. According to the American Foundation for Suicide Prevention, over 50% of all people who die by suicide suffer from major depression. If one includes alcoholics who are depressed, the figure rises to over 75%. Suicide, for anyone who doesn't know, is the act of intentionally causing one's own death. When a person seems to be depressed and suicidal, there are many ways to tell how they are feeling and what they are thinking. If someone is suicidal, they may mention phrases like, "I don't want to be here, what if I were dead?" When confronting a person who is possibly suicidal, avoid minimizing that person's pain and suffering. Try and stay away from saying things like, "everything is fine." Instead, say something slightly supportive like, "I know the world is not on your side right now and you feel hopeless, but I believe that things will get better for you." Suicide is not something to joke around with. If you know somebody who is in need of help, help them and save a precious life. Treatment for even most severe cases of depression is available. According to the National Institute for Mental Health, depression is usually treated with medications, psychotherapy, or a combination of the both. If these treatments do not reduce symptoms, electroconvulsive therapy, ETC, and other brain stimulation therapies may be options to explore. Antidepressants are said to be the medication to treat depression. They may help the way a person's brain uses certain chemicals. Medications are not always the answer. Many people eventually become addicted or immune, which may lead to them taking more than that is prescribed. Psychotherapy, or better known as talk therapy, can help a person with depression by always allowing them to express how they feel with no judgment at all. Studies have shown that talking about personal issues with a person that doesn't know who you are has helped depression a tremendous amount. Depression is a serious problem in the world we live in today. It is never going to completely disappear. If the symptoms are there, something needs to be said and done to help before another tragedy hits the world. Too many wonderful people have committed suicide due to this disorder, and it needs to stop. There is nothing wrong with getting the help you need to better yourself and the life you live in. Just like Tony Sorensen said, strength comes from struggle. When you learn to see your struggles as opportunities to become stronger, better, and wiser, then your thinking shifts from "I can't do this" to "I must do this." Thank you.